Okay, welcome back to another episode of the Digital Health Podcast. We have an amazing episode for you guys. If this is your first episode and you don't know me, my name is Anthony Virgo. I spent the last 7 years at a health tech startup, and now I am doing my own AI automation agency along with my co-host and my partner, Khizar. Khizar, go ahead and introduce yourself.
Hello everyone, my name is Khizar Shahid and I have been working in the healthcare domain for quite a while. I started with the dental practices, and then when we collaborated together, we started working with all of the healthcare professionals. We are working with psychotherapists, we are working with physiotherapists, we are working with dental practices. So this is a brief introduction about myself. Now I want to kick it over to our guest Charles.
Hi, good afternoon to the audience, and certainly nice to meet you, Anthony, and Khizar. Name is Charles Clemens. Serve as a hospital chaplain within the UCLA health system, but also I'm a pastoral counselor within the community, working with individuals virtually who may be going through grief, trauma, or in areas of mental health, or even dealing with families affected by suicide, among a number of life challenges. So looking forward to this conversation and the good use of technology to connect people.
Got it. And first and foremost, thank you so much for your time and just joining the podcast. Usually we like to open up to kind of figure out where did someone start or where did they actually get this passion or fall into healthcare. So I want to ask you, how did you come into this specific industry? Was it something that you knew that you were going to go on a path towards at a young age, or is it something you kind of fell into by accident? The reason why I ask is because in my journey and a lot of other people that we actually had on the podcast, they kind of came into healthcare by accident. Me, myself, I was in sales before, so I was a car salesman, and then I got into healthcare after. Two kind of different dynamics. So how did you get started?
Wow, great question, Anthony, and thanks for asking that. I didn't quite know that I was landing in healthcare profession, early on in life. My father, who had been a Methodist minister, and he also was a bulldozer driver, he was very active in the community. So as a child, I remember him taking me to hospitals to visit people from the church. So dad would come home, he would shave, get cleaned up from his work with bulldozer work. And I remember walking the hallways with him at Monmouth Medical Center when I was about maybe 7 or 8 years old. So I saw compassion at work. I saw him interacting with doctors and nurses when they would get some news. They would have to bring that news to bear on that patient or family. And these were people, real life people we knew. So if it was a cafeteria worker who was in the hospital, Sister Jane, or if it was the bus driver, Deacon Bob, or who have you, but these were real people facing real challenges in the hospital. So to answer your question, over the years, as I went into college and looked at physical therapy and looked at other different therapeutic modalities working with the disabled, it was kind of something, a background that I was already a bit familiar with, but wanting to work more with people facing challenges in life. And so that's what gradually led me over to clinical work, getting my degree, getting my master's, getting my studies in divinity, but also working with people facing significant life challenges. And then roughly for the last 30 years, in some form or fashion, I've worked with healthcare systems, worked with leaders, staff, and technology has really helped to bridge some of those gaps. And certainly when we had the lockdown with COVID, there was a large number of people going through some really challenging times looking for a way to connect with people. And so using those platforms online has allowed me to do that too.
Amazing, amazing. So there's definitely a lot of different things that you touched on and what you
Mhm.
just said. It's amazing that your dad was like doing bulldozers and then
Yeah,
cleaning himself up to then going to the hospital and things of that nature. So
yeah.
to me it looks like you have had a lens in the healthcare or a some sort of healthcare system for a long time in some way, shape, or form, whether you realize it or not. When you were
Right.
going with your dad, I guess my question is, from your experience or what you know now, what are some things that are, um, I guess, wrong with the healthcare system as of today, that you would love to kind of see evolve or transform, or it could be something that was an issue when you were first getting started, but now you've seen has now been a really great benefit. For example, when I first started myself in healthcare, it was like around 2016, and telehealth wasn't even really a thing before.
Right.
Then 2018, 2019, then the pandemic, we saw how beneficial something like telehealth was. So what are some things on your end that you might have saw, or there's some things that you're thinking about changing in the system that you think should be changed?
Yeah, great question, Anthony. And I think there are challenges and opportunities. There's a lot of good too, and we'll look at the challenges and then look at the good. I think the challenge when you're dealing with people facing multiple physical illnesses, a burdened health system, rising costs that are put onto the regular folks, people are flooding to places to receive treatment, but often don't have the resources to afford it. And so that's a really larger issue that invites us all to be politically active and engaged just on that's a whole other discussion if y'all want to have it. But I also think for those who are in healthcare, and this goes back to my dad and the people I've seen over the years, we are in the healthcare space. We have to balance that sense of compassion and competence, meaning being, and I learned this from a good friend from New Leaf Training Development who does corporate training, the compassion piece, that can't be manufactured. You got to have heart for the people. So whether you're admitting clerk and the whole emergency room is full, whether you're a therapist, counselor, coach, and you're in the virtual space and you're managing virtual discussions like this, or whether you're showing up to a brick and mortar office and you're providing a treatment, a dental service, or have you, people can tell if it's something from the heart or if the heart checked out. Statistics say, I think Forbes put it, quiet quitting is close to 50%. And for the audience, that means people can show up physically, but they have no heart investment in the work that they're doing. And I don't know about you, if I'm flying a plane, I'd like my pilot to have his heart into it. If I'm going in for a surgery, I want that doctor to feel kind of good about what he's doing. And that will go across the board. So the compassion part is essential. Even to feel a sense of purpose and thrive at work, you have to have something to give. Competence is doing your job well. So a sense of excellence, execution, and I'm really glad and honored to be a part of this discussion to hear your two journeys, because being competent means you have the sense you're growing in your craft, you're growing in your skills, and I think the tools we have through virtual work, it helps to enhance that competency. Let me give you a real life example. I do grief groups, and that means individuals that have had significant losses and deaths in their life. We meet individually, sometimes as a group. And during the pandemic, I worked with some individuals who had major deaths in their family, including one, a suicide. And we were able to connect thousands of miles apart to do significant grief work. And this is years ago now, and these individuals are going on thriving. And so through the use of tools like this, it enhanced my own reach and impact in my little niche within the area of mental health / spiritual health and pastoral care, outside of my regular 9 to 5 as a hospital chaplain. So the competency piece is key. A sense of growing as a continuing education process we ought to be developing, and in those who are in leadership spaces in those places, we set the tone, like, are you growing? Are you being stretched with your craft or your work? But then you can't check out on the heart. And so I think I've seen that in the nearly 30 years, 3 decades, my goodness, in healthcare, that people tend to go 2 tracks. There's some who are thriving in their workspace and growing, developing, and on the cutting edge of things, such as what you're mentioning here today. And then there are others who kind of autopilot, and it shows, and they need a bit of help. So those are some of my thoughts. There's some practical things with that too.
1,000%. I think that resonates, because especially the piece about, like, am I growing or something like that. Like, even, at when I was at a health tech, it was a startup. So the atmosphere was super different from what I was used to in a traditional job. Not even just healthcare, just a traditional job. It was brand new. I was able to wear many hats. I was able to use my transferable sales skills that I had now to impact the healthcare system. And it gave me that sense that I was developing and becoming better. I guess in a follow-up question, you mentioned that, you do a grieving groups, or you've work with people who've had really life changing trauma, and then there
Mm.
might be people on the outside that might not even had that trauma, or it hasn't been that close to them as of yet.
Yeah.
What is, I guess, one misconception about, some of the people that you work with, or someone who might be grieving? What is one misconception that the average person might not know about in the work that you do?
Great work. Particularly in this thing of grief, or more specifically, a bit dealing with issues of suicide, and we're diving into mental health space slash spiritual health. I think one misconception is that people think that it's going to automatically be seen on the outside, that somebody's considering suicide, someone's considering maybe making a really horrible decision to harm their own life or affect the life of others. And I think the big misconception, and I do a lot of work with men, is that, to be, a man, that you can't show emotion, feelings, or so forth because our society punishes that. Shed a tear, express a feeling, you're being soft, all that kind of stuff.
Right, a
And,
thousand percent.
and so with that, I've seen and worked with guys that either explode or implode. Explode, they crash out and they're hurting other people, and we're seeing that today in society. Or implode, they go and hurt themselves. And so in some of these spaces, through virtual, even outside of the brick and mortar of an office, I may have conversations where people have literally met with me week after week, and they're able to take the mask off and say, here's where my pain points are. And I don't meet them with a tisk tisk tisk, I listen. And in the process of listening, able to walk through that pain and look at some practical solutions. As I'm saying this, I have people in my own life that I can do and be that vulnerable with too, and help me see a pathway towards a better approach and healthy healing. So I think there are a lot of people suffering in silence. There's a lot of shame around those things of saying, I'm broken and here's where. And there's also the misconception about, and I'm speaking more specifically now with men, but that there's certain expectations that you have to live up to be this, and I say those things are patently false. Um, the other part That's the other part, is that there's a distrust with healthcare, speaking healthcare in general. And so because that distrust in healthcare is so pervasive, because of some cases past inequities and so forth, people are afraid to access those things, not just in the mental health space, but just going in for a checkup, a physical, what have you. And by not addressing those things, then a person's more prone to poorer health down the line. So I think through technology like this, it gives a broader reach, not only myself, but clinicians, and it also makes it a bit easier for people to access those things. So maybe someone wouldn't go to a group discussion on dealing with grief at the hospital, or dealing with, living with cancer, but they may sign up for a virtual thing because they can do it from their home. They can put a headset on and not feel as uncomfortable. So there's the misconception of vulnerability or areas of distrust, and I think properly technology helps to bridge those gaps.
And now, Charles, I want to move our conversation towards the AI aspect of the
Mhm.
technology. So,
Okay.
how do you see the AI, the latest technology, integrating with the healthcare? Like, first of all, let us know that are you for the AI, or are you the one who is against the AI?
Yeah, I appreciate you asking that. I'm actually for its ethical use. I'm for it. I do recognize it's a complex thing, like with introduction of any new technology, and history shows, when we went from primarily agrarian to, the industrial age, as coal and all that. And so we're always in this tension of how do you use this tool while being mindful of what it can be detrimentally wise. I don't think I have all the answers, but I'll speak for me that AI has helped me to be more effective. Let me give you an example, even a basic tool as note taking. So if I'm having an intense conversation with someone, And rather than them lingering in their grief or thoughts of suicide, we begin to talk through how they were raised, how that impacts their thinking. I give them a list of 3, 4 local agencies that they can access, support groups. We talk about affirmations. We go through a comprehensive things. Now, if I myself had to write all those things down in the midst of a very difficult conversation, in that moment, the person's really opening up in a huge way. But now I have someone, or excuse me, something, AI, who's recording those things. So I can go back, pull that data, and I'm able to curate it and then say, hey, here's what we talked about. So the next time I meet with this person a week later, a month later, or days later, we have some action points, and that even extends my own reach. So now rather than being bogged down with an hour and a half of and that's not to excuse or not be diligent to do the due diligence. It's not an excuse not to work. Let me be clear with that. But in that instance that I gave, it directly helps the bottom line person who needs that help. Now, that's what works for me. I feel good about that. And that's just the tip of the iceberg of some of those areas that now, granted, there's a larger discussion about the pollution elements and also let me just say this, not to go on and on. There are people coming up with solutions for those centers, even inventing things at sea to help decrease, overheating. So but that's out of my domain. But the part that I use has helped me and the clients I work with significantly.
Yeah. But one thing that we often hear from the healthcare professionals is they used to say that healthcare is the people's business. There is no place of AI in the healthcare. So how do you see this? Like, if there is any healthcare professional sitting in front of you and he say that there is no place of AI in the healthcare,
Oh,
AI can't replace any healthcare professional. So how do you see?
well, that's a good question. And it depends on what they mean by that. Like when people speak in such absolutist terms, it might be good just to ask the question, are you open to considering another perspective? And I'm 55, and sometimes I ask that right up front. That way I know, because if there's not an interest, not to be rude, then that lets me know that conversation is a waste of time. Um, but if they are interested, you may want to ask, well, what do you mean by that? Do you mean replacing people literally, that there's no work? Or are we talking about assisting, like a device that assists individuals? Because there's definitely precedent of assistive device. I mean, literally, prosthetics are an example of things that assist people physically. Now, with regard to this technology and your question that you asked, I would just ask first, are they interested in hearing another perspective? And then second, if they are, then what's the ethical use of it? Meaning that if there's staff that potentially could be laid off and there's a downside of using a device that doesn't have a personal touch. I think we've all called in to phone centers and this is Bill from such and such, and option one. What if my option isn't between 1 and 9? My option is like 12 and 15, and I'm not getting the thing addressed. And then the company itself, whoever it is, needs to come to some kind of position ethically, like what are our own core values as relates to, yes, we need to make a profit. This device can help us to do that. Maybe rather than 50 employees, now it's 30. And this isn't a popular thing. I get that there's some hard discussions. And going back to the example of distance, I know there are physicians that I've come across different systems that if they're traveling, they're able to access these things and even have a present device to help them in emergencies or in appointments, to have appointments that they would have to push people off months, or in some case much longer. So to answer your question, I would push back a bit to that person that says no and ask them, are they open to that conversation? And if they are, then the nuance. Is it ethical aspects of this that they're for or against? Is it practical application? and then find how the tech actually will be of benefit. And 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 within hospitals, they have ethical committees too. This discussion is happening. By the way, I'm not speaking for my health system now. These are just my own thoughts. But there are policies being written, which I'm sure you're familiar. Here's the proper use of this. Here's the improper use. And when people join up, they have to be willing to abide by those codes of conduct or ethical use of things. And so those are some of my thoughts. I don't know if I answered your question fully, Khazar, but I gave it a shot.
Yeah, perfect.
Yeah, I think that was spot on. I think that's exactly what we see in our line of work as well. Like I think we run into people where there's a lot of people who are like forward thinkers and like they're for AI. They see the benefit, whether it's just like even something like transcribing notes is gonna
Yeah.
support with helping you become more present, right? Being that you're not
Yes.
writing now, you're more present. And then you have a reference from an agent that's already transcribed almost everything that went
Hmm.
on in the conversation. At that time, all you would have to do is go over it to make sure that it hit the points that, you were looking at, or add in the few interesting the thoughts that might have came to you during the conversation that the AI might not have picked up on.
Absolutely.
But it allows people to be more present the way they use it. And then if you're talking about healthcare, obviously you need AI to be HIPAA compliant. You need it to be,
Hmm.
ethical in some way, shape, or form, or measuring that the ethical practice of it, right? Like, what is this
Hmm.
thing here to do? If it's here to make our is it going to make our work harder and lay off 20 people? Then we don't need it.
Hmm.
You know what I mean?
That's right.
Like that's
Hmm.
why would we
Yeah.
even need it, right? But if it's gonna optimize the staff to kind of move better or perform better, that's what at least that's what we preach over at A Plus Active Services, where we never like to say, hey, we're replacing people with AI, or
Hmm.
we want AI to replace a front desk person or a provider. That's never the angle where we come from. We always come from a place where we are your AI partners, meaning we want to give you AI, but we also want to train you. We want to equip it with you. We don't want to give you an agent and just say bye. We want to make sure that you're able to use it because you're
Hmm.
going to be managing it. Of course, we're an email away or phone call away should you need support, but what our goal is to help, especially in the healthcare system, help people kind of even the playing field and know how to use the technology as it evolves into our industry, because the AI or just technology in general in healthcare, it changes so often, but it's not
Mm.
going away. You know what I mean?
That's
It's
right.
not going to, especially if it's making things a lot more efficient. And healthcare is weird because you have so many people that's patient and client facing, and that motivates them. But you also have a side of healthcare that's numbers driven, that's efficient, that's what does the balance sheet look on this, and you know what I mean. At least
Hmm.
that was the side that I was mainly on, where a lot of decisions were
Hmm.
made. And not knowing, right? I think in healthcare is so it's not a one size fits all, because there's so
Right.
many things that affect the health.
Yes.
We're talking about one aspects, but there's layers, right? We know that someone,
Hmm.
and I'm sure you'll see it in your work.
Absolutely.
Someone could have hypertension, diabetes, or what have you, but also they might live in a certain neighborhood that's like a food desert. Though
Hmm.
they don't have
Right.
enough good food to eat, or
Hmm.
the neighborhood stressing them out, and now they have mental.
Hmm.
There's so many different ways health could be impacted, so it's never a one size fits all.
Yes.
And I always say to providers or anyone in the healthcare space who might be turned off of AI, is my first question is, are you using AI outside of work, right? Do
Mm.
you even know what AI is outside of
Yeah.
work? Or is it just a tool that you just know that, hey, my company just implemented this and now I got to use it? No, use it as your day to day and
Hmm.
understand it. And then you could kind of see where the benefits would then come into your line of work, I think.
Mm. Well,
Mm.
those are great insights, and enjoyed this conversation. And I appreciate what you just shared there, giving people a chance to really think about it a bit, and you mentioned the nuances of healthcare,
Mm,
and
mm,
it's not always like a zero sum or one size fits all. I believe, as you said that earlier, because so much impacts a person's health. And the examples you gave, being in a food desert, being in a really high crime area, or what have you. And so, as most of our healthcare workers, their time is already stretched across the board. And so, one way to consider it is this tool isn't necessarily just to replace people, but also, again, enhance services to give opportunities for people to have compassionate care. And so, that's something I often repeat, that the care and treatment we give should be with compassion. Any tool, not just AI, but just in general, does it help with that? And that comes back to that individual person. Like, are they treating people from that place? And so, if they are, AI, among many other tools, becomes a means and not an end. And if a person, and again, great examples, guys, if they're patient facing or not patient facing, and if compassion is what's driven, then those tools will be opportunities for greater impact, more excellent care, compassionate and competent. If their driven issue is just money, and we need it to pay bills, but if they're primarily driven by greed and avarice, then it'll show up too. I've got something that I can use to not show up at work, and so it like any tool, it enhances, good or bad.
1000%, 1000%. Now, are you seeing that? I guess in your experience, not specific to your health system or anything like that, but are you noticing that our providers or people who are more so on the clinical side, are they starting to become more open to new technology such as AI? Do you see them integrating it a lot more, or are we still at a place where it's like a lot of hesitation? I know it varies across like demographics,
Mm.
especially here in New York. There's like a few clinical practices, usually on a smaller side, that's where we're doing AI almost everything and has been efficient. But like the large health systems, like I'll say like a Mount Sinai, NYU, they're using AI, but it might come from like the top down versus
Mm.
where clients might not even notice AI is being interacted. So from your perspective, are providers open to it? Is it being
It's
enabled?
again, I'm not speaking for my health system, but just my interactions with healthcare providers across my own networks. I see it largely being used, probably more than two-thirds. And in some instances, it's helping, just the speed of things. So if someone, let's say, we're wanting to look at best practices for the OT industry, occupational therapists, or best practices for, a chaplain, or best practices for this or that. They're able to access just a volume of information really quickly. Of course, not to neglect, books and reading or research that's dealing with the hard physical materials. So, in general, in record keeping and research and the speed to collect things. That happens quite a bit in more social service agencies, individuals that I know that do a lot of resourcing of the unhoused, people on the streets. Um, if they can sit down with a person who's been on the streets 2, 3, 4 months and come up with a comprehensive list of the local 20 shelters within a 30-mile radius with wraparound services, with direct phone numbers, with active websites, and print that off in 5, 10 minutes. And then they look behind that person, there's 30 other people in that line. And out of that list of 20 some odd places, more than 12 of them have active representatives. That's a good use. And so I'm kind of beating the drum for AI here. So I have seen individuals do that, regularly do that. Some of my friends are in the streets regularly doing homeless work. This is where the good of that I see it being adopted. The debate around environmental issues, around plagiarism, around faulty data, because as y'all are aware, I'm sure AI can be trained, what you put in. I do see some pushing back big time with it, family loved ones who are vehemently against it. Um, to me, I think it's much like any technology. It's how you use it. I got I love cooking barbecue. I have knives in my kitchen, and they're used for cooking, you know, not the other thing. And so it's like any technology. That's my opinion. Bit simplistic. And the people I see in healthcare, 2 out of 3 or more are leaning towards using it.
1000%. I always say, like, just because you know how to use a hammer don't mean you know how to build a house. You know what I
Th-
mean? Is you just
There you go. Well said. That's a good quote. That's a
I
really good.
always say
I have to borrow that. I'm gonna cite Brother Anthony Virgo. Just because you have a hammer does not build. Hey, that's true. It's good
yeah,
for house building, though.
1000. Yeah, right.
Yeah.
100%. All right, Charles. This has been an amazing episode. Gonna wrap it up with, I guess, two more questions for you.
Okay.
One is, where's the best way people could kind of connect with you, whether a listener loved what you heard or just wanted to reach out about any questions or resource? What are the best channels to reach out to you and actually connect with you? And then if there's one powerful message you wanted to leave with a listener based on what we talked about today, well, it could be broad, it could be AI specific, it could be healthcare specific, it could be specific to what you're doing currently. It could be as broad as possible, but one powerful message that you wanna leave with the listener. So yeah, your
Wow.
channels and one message.
Okay, great. I appreciate that. My channels, if you enjoyed the conversation, I have what's called the On Purpose Leader podcast. The On Purpose Leader podcast, you can see us on TikTok, on Instagram, and the full interviews on YouTube. And I'll be sure to forward you guys those links. And then one message I would leave is really echoed in the life of my dad. Life is so much better when we give to others and not just to ourselves. Let me say that again. Life is so much better when we give to others and not just to ourselves. So, in other words, we're blessed to be a blessing, and so it's better. Yeah,
Definitely. I love that. I appreciate it. Thank you so much for being open, for talking and taking the time on a Saturday to really be on a digital health podcast. And we can't wait to have another one on part 2 for sure.
fantastic. Thanks, guys.